Hey, let's bring our next guest onto the show. Always enjoy our conversations and education and insight with our good friend, Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. And, Joe, good morning. What do you have for us today?
Hey, Ray. How you doing today?
I'm doing terrific.
Great. Happy holidays. Merry Christmas to your whole family. And
hey, same to you.
Have
same
a great week or two here.
Mm-hmm. Hey, don't forget my birthday. It's December 23rd.
Oh, my gosh.
Hey, don't forget my anniversary. It's December 27th.
That sounds good.
We do it all at once, Joe. We don't mess around.
Oh, my gosh. What a big week you have coming up. I hope you got enough rest, Ray.
I hope so.
So, Ray, we talk about different aspects of the medical team, the sports medical team. It's, you learn a lot of life's lessons from sports, and on a good sports team, you need a little bit of some people with good talent and gifts at all sorts of different positions. One area for us on the sports medicine team are sports physical therapists. They're so important. So like right now, Ray, who's treating Isaiah Thomas's hip or Michael Brantley's ankle after the surgery, Joe Thomas's elbow? The people that are working with those folks, getting them better, getting them ready to be back on the field at some point and be productive athletes are physical therapists. And there's specialists that are sports physical therapists. And you and I talked about a tool about a couple of years ago. It was brand new. We try to bring out new things for your audience, and there was a new thing called dry needling that was being done by physical therapists. And I don't know if you're aware of this, but it has now in the last year or two grown so significantly, and it's such an important part of helping get people better that I wanted to mention it again and just update people. I wasn't even sure a couple of years ago what role this dry needling was going to have for physical therapists to get athletes moving, to reduce the amount of pain, to reduce the amount of inflammation. It's a little confusing for athletes because it is not acupuncture, but these small filament needles that are used for dry needling actually really help the body, enhance the body on its own to get rid of inflammation and get rid of pain. And in this day and age where we're trying to avoid a lot of medicines or things with side effects for pain, dry needling has become another tool. It really, in the sports medicine bag of tricks for physical therapy, has become an essential tool. And the hottest, newest thing right now in the last year or couple of months is called neuroneedling. So early on, Ray, we were mainly doing muscles and tendons, and now we're working a lot around the area of nerves to reduce pain, to get the function going, to improve and enhance athletes' performance. And so from that standpoint, neuroneedling right now is one of the hottest things we have going. And if you are getting any physical therapy done, ask your physical therapist if they do this tool, because it's been so significantly helpful in getting our athletes going. It's good for normal people, too, in the population.
How does it work, Joe?
Okay, so these small filaments, really, very thin needle is used, and instead of, like when your therapist is doing massage or doing this thing called Graston with a tool to break up some of the scar tissue, with the needling, they can get a lot deeper from the skin into the area of the muscle, the tendon, or now to the area surrounding the nerve. And so by reducing pain, getting rid of inflammation, it's actually speeding up the healing and helping the body heal on its own. And again, whenever a new tool is introduced, we're not so sure, but oh my gosh, Ray, the results that people get now with dry needling make it very clear. And many, if not most of the physical therapists in our area do it. It's very not painful. It's not acupuncture. Small filaments that allow the therapist to get deeper into the tissue that's been damaged or injured or inflamed and help speed up the healing.
Joe, one thing that I noticed when I was out in Arizona last year as far as physical therapy and this type of thing, I saw a lot of this thing called cupping. And I saw a lot of the Indians getting this done after the workouts, before the workouts. What is this? And maybe educate all of us on what that is about.
So cupping is another physical therapy tool. So this is also in that same area of the person on the sports medicine team, the sports physical therapist, in their way of trying to speed up healing, get rid of inflammation. In this way, actually break up sometimes some of the scar tissue or adhesions following injuries. And in so doing, it gets deeper underneath the skin, and there will sometimes be a lot of bruising associated with it after you see people using this cupping in a way to get blood flow back into the area again. As the blood flow comes back into the area again, obviously the muscle and tendon is going to work much better, and obviously the people are going to be playing quicker, performance is going to improve, and so this is another tool, cupping. It sometimes, especially in a pediatric clinic, sometimes people will leave with a lot of bruising, and it doesn't look so great, to be honest. You may have noticed that if you saw people that have had cupping. But it is a tool that's helpful, and it's out there like dry needling, and like everything else in medicine, we're always pushing the envelope to come up with new ways to speed up the healing, and cupping and neuroneedling are two of the hottest, newest things that our physical therapists can do to get our athletes playing well and playing quicker.
You know, for the parents, grandparents, guardians out there, Joe, we have a lot of our, grandkids or kids in general participating in the sports. And for us to be a home physical therapist, is it still the old fashioned of, hey, if your arm is tired, let's ice it, let's warm it up? What are some, real basic guidelines, maybe for a sore arm, a sore foot, that type of thing for everyone to pay attention to inside their own house?
Yeah, now we're slipping over to the other side of sports medicine with that question, Ray, is not just afterwards, after the injury or surgery and treatment, is beforehand. And the biggest thing that we talk a lot about when you're talking about just to start simply is listen to your body. All day long, I see kids who, under the guidance of parents and well-meaning trainers and coaches, are overdoing their body with repetitive activities over and over again, whether it be running or throwing or kicking. And we see so many of these things, and we have to listen to the body. So the body's, when you're beginning to get achiness at night before you go to bed or the morning when you wake up the next day, it's time to take some time off. And many times, 24, but especially 48 hours of relative rest, from that particular activity, can be one of the best things you can do in the way of helping regenerate your athlete and get them to be healthy again. So on the front side, trying to avoid doing too much and getting injured. And on the backside, in those cases where people are injured, knowing some of the newest tools that are out there, like cupping and needling, are things that you have to trust your sports medicine doctor that we're going to be up on the latest things, and we're not going to tell you to do something that has side effects or that's going to be dangerous to your athlete. And these are a couple things that have almost no side effects, can help reduce pain a lot, can help reduce the need for medicines, and are tools that I wanted to introduce this morning.
Awesome stuff, Joe. Listen, have a good holiday, my friend. We appreciate your time during the 2017 year and for sure in 2018. Thank you, Joe.
Thanks, Ray. Take care. Have a great week.
You too. Dr. Joe Congeni joining us live this morning, Akron Children's Hospital here at 50.